Hi, my name is Dr. Joanne Jackson, and I am a physician manager at Ryder, Hill & Johnson of Advantia. I'm also the medical director at Live by Advantia. I first joined Ryder Hill in early 2006, and I've been here ever since because I honestly love it. RHJ, as we call it, became part of the Advantia family on March 1st, 2020, literally days before the COVID pandemic was declared. I am forever grateful for that because having the support of the entire Advantia team honestly allowed our practice to survive what was probably the greatest turmoil that I think healthcare practices in the US have ever faced. And I'm happy to report that as part of the Advantia family, we have continued to grow and thrive. Live by Advantia welcomed its first patients in early 2001, and I came aboard as medical director in April of 2022. Live is really a beautiful concept, and I am so excited to be a part of the team that's helping it to grow and blossom into everything that it was ever imagined to be. In my everyday work life, I perform all the full spectrum general OB/GYN care duties. So I see OB/GYN patients in the office. I do deliveries at Sibley Hospital. I continue to do major and minor GYN surgeries. It's exhausting sometimes, but fortunately, because I genuinely do love my job, my patients, and my work family, that makes it okay. As a physician manager and medical director, I am responsible for coordinating the day-to-day management of the practices. So patient care comes at the heart and center of everything that we do. That's absolute priority number one. So I see my role as prioritizing the needs of the patients, the realities and needs of the providers who are taking care of those patients, and then acting as a liaison between those two groups and the management teams who support the practices at both the local and Advantia-wide levels. We try really hard to prioritize work-life balance, preventing burnout, protecting the quality of life of our providers, while ensuring that we're also meeting our financial targets, our quality measures, our patient satisfaction goals, and all of the compliance measures that we need to check off. So it's a tricky balance sometimes, but it's been really helpful having an Advantia HQ support team which shares those same values and priorities. It really makes it a lot easier. In my role as part of practice management, I've had the pleasure of forming really great working relationships with a lot of the Advantia HQ support team. And honestly, I talk to several of them multiple times a week. And that's actually really amazing because having gone from being a partner in a private practice, at RHJ prior to us joining Advantia and going through the transition to where we are now, I can honestly tell you it's been a pleasure and a huge relief. As physicians, we are not trained in business management or healthcare administration. So while running a private practice, I often found myself in situations where I needed to make a decision or, just in a situation where I just didn't feel equipped to handle it. Fast forward to my current situation where I literally have an entire support team that runs the gamut, everything from EHR specialists, recruiting, marketing, finance, operations, legal, HR, credentialing. I'm sure I'm forgetting some people. And a very, very accessible CMO, CFO, COO, CEO. It's literally night and day because I get to focus on what I'm good at, medicine, while I have the benefit of the support of all these experts who are really good at what they're good at. And I think that together, it allows us to build a team. And because of that, Ryder Hill has been allowed to grow and thrive. And we have been able to maintain the culture of a private practice, which I think is a wonderful thing. And I think that's largely because all of our physician managers, as well as the CMO of Advantia, are practicing OB/GYNs. It's a very important distinction, and I think it sets us apart from some of the other organizations. And it allows us to really prioritize that work-life balance. If I had to give advice to new grad looking for their first job, Do your homework. Understand the contract. I am from a generation where practices, as they were hiring providers, relied on the fact that we had no idea what the terms of those contracts meant. You are no longer in a situation where you need to fall victim to that. You are not taught contract negotiation in medical school, residency, or any of your rotations, but fortunately, there's an entire world of information available to you. Please use it. Protect yourselves. Build a picture of the type of practice you would like to have. Think of your future, think of the type of patients you'd like to care for, the location you'd like to live, and the quality of life that you'd like to have. The one that I think a lot of people overlook is very carefully consider the group of people that you're going to be working with. Talk to as many people as possible in any group that you're going to be joining and find out what the culture of that practice is like. Make sure that it's a good fit for you.